So I'm Rebecca Bozarth. I'm a veterinarian, so Dr. Bozarth. Um, I'm originally from Bend, Oregon, and so always Pacific Northwest kind of a person. I graduated from veterinary school in 1991, so I've been practicing for 34 years. I have owned a small animal practice. I was in an internal medicine residency, and then I've worked in emergency medicine mostly for the last 10 or 12 years. And then I started doing some work here for the Humane Society about a year and a half ago when they lost their veterinary services here. And so I started trying to fill in, and I just fell in love with it. And so I was really happy this year that they were able to offer me a full-time position, and I came in working here in February as the Director of Veterinary Services. There's the responsibilities as a veterinarian, taking care of all of the shelter animals, taking care of injured animals when they come in, spaying and neutering, and doing other surgeries, sometimes taking out masses or taking out foreign bodies or amputating limbs. So the medical care of the animals that are here. There's public-facing duties like vaccinations for the low-cost community and medical care for animals in low-cost community. So providing those resources, but also just overall the processes in the hospital for dealing with things like and in the shelter for contagious diseases and behavior welfare. So there's a lot of management pieces as well as normal veterinary tasks that I do. The Humane Society has a vital role to play here in this area. Without a Humane Society here in this area, all the animals and the people in the area would be suffering. And they're really the only place that is filling this role for a very large area. And so taking in animals that need care, helping them find homes, helping deal with neglect cases, which has been a really serious problem lately. We've had a couple really large animal neglect and animal abuse cases that we have worked together with animal control to manage those and get those animals the care they need and into better homes. Spaying and neutering and providing vaccinations. There was just recently a parvo outbreak at a homeless encampment, and we went in and vaccinated all of their dogs for parvo for free. We're working in the community to help get dogs on trails safely. There's going to be dog walks. We take in kittens that are needing to be bottle fed. Like, it's vital. Without that, animals would be really suffering in this community, and so would people. I'd like to get a veterinary technician or two hired. If anybody out there is a veterinary technician and would like a certified technician, would like to be working and saving animals and having that warm heart feeling every day, come and talk to me. We'd like to hire another veterinarian, so we have veterinary services 7 days a week here. Right now we have spay and neuter services 2 days a week, sometimes 3, and we have veterinary services 5 days a week for the shelter animals. We only have 1 day a week that's a vaccine low-cost service right now, and so mostly our time is taken up with the shelter animals. For the shelter animals and the public, we really want to get the trap, neuter, and release program going here. So there's a lot of feral cats in the area, and the feral cats have these colonies, and people feed them, and they multiply and have lots of babies. And we can spay and neuter those animals for a pretty low cost, or sometimes we can get grants for that, and then they can be in place and not be creating more babies all the time and not getting diseases and things. So there's so much on our plate right now of ways to expand and ways to help in this community, and that's kind of my mission.